in society today and the way we are today, we have car accidents. We have boxing, we get hit on the head, we have football, basketball. When someone gets hit in the head or the body, and we might have a whiplash where the jaw takes an uncontrolled movement, we can get what's called, I call it, a sprained ankle in the jaw. The jaw is held there, suspended with ligaments, and it's a closed capsule, and there's a little piece of cartilage that sits there between the two bones, between the jaw and the head. And if it gets sprained or it gets out of alignment, if one is out of line, pretty soon the other one's out of line. Because even though they're not attached, it's one piece that kind of floats around here. The jaw is not like any other joint in the body because it moves in all three planes. It moves this way, it moves that way, and this way. There's no other joint that does it. So when the jaw does have an injury, and it's usually with the little cartilage that sits between the jaw and the skull, if it slips off, it always slips off forward, which makes the jaw go backwards. Because the thing that's holding it in place, that's supposed to stay there, now falls off here, and now the jaw goes further backwards. You have nerves, you have the carotid artery, so when the jaw is not in the correct place and it's too far back, it now can impinge on nerves and arteries, vessels basically, that go to other places. So now in effect we have challenges somewhere else. And you can imagine if you don't get enough air, it's going to cause other things to happen with the brain. The brain has 12 cranial nerves. There's a nerve that comes out here, out of the brain. It goes through here. It has sensory function, which means touch, feel, proprioception, and it also has motor skills to it. So you have the moving of the jaw, swallowing, these things, the face. If you have all 12 nerves do 100%, this one nerve occupies 35% of the brain. It's energy. It sleeps with 3 other nerves. What I mean by sleep, when it goes back to the brain, it goes through this part of the brain. It's called the reticular formation, but to keep it simple, these nerves are all together for 3-4 millimeters. So these nerves that are together for a period of 4 or 5 millimeters, if one is on fire, it kind of reacts with the other 3. The other 3 are pretty important. One is the vagus, the hypoglossal, and the facial. So now we have 4 nerves that occupy about 60% of the entire brain's function. That's a pretty big number. So these 4 are pretty important. So this one nerve that's back here that goes back into the brain is responsible for these functions of the head and face. So now it's affecting the vagus nerve, which is intestines, which is stomach, which is breathing. These things are pretty important. Swallowing, the hypoglossal. And then we have the facial, and face pain, face, eye movement. So all these things that are getting together having nothing to do with actual here, but what the signals are being sent elsewhere. If this nerve and nerves are being irritated by the fact that the jaw is in the wrong position, what we do is basically make a little appliance that sits in your mouth to alleviate that pressure that's affecting that nerve and the nerves involved. I'm taking you off of my toe that you're standing on. You're standing on my toe and it's killing me. So now I get you to move, and I move you off of my toe, and all of a sudden the toe feels better. Once we move the jaw or get a better position so that the nerves are not irritated, so we see this immediate resolution. And we do that basically with just appliances that don't allow you to go back there and hurt yourself.